Today I thought I would talk a little bit about pictures at the hospital. And some of our most popular pictures that we do are x-rays, MRIs, and CT scans. So the first one I thought I would introduce is just x-rays. Those are one of our simplest procedures that we do. It's not painful. It's literally just a picture of the inside of your body. And so for older school-age children or adolescents, I don't really go into a whole lot of detail because usually they've seen an x-ray on a TV show, their friend has had an x-ray, they've had an x-ray when they were younger. This is something that's just a little bit usually more familiar for kids. If I am describing it to a school age or a teenager, I just describe it as a picture, simple as that, just a picture of the inside of your body of whatever's hurting. So usually we do x-rays for any kind of broken bones. For the toddler and preschool age, I like to show them it in terms of this cute little Doc McStuffins camera that I have. And inside are all of Doc McStuffins' friends. So this is Lammy. And so I'll show them that this is kind of what the picture looks like, is of the inside of their body. And so the inside of their body lights up. We're able to see their bones and make sure that nothing's broken and nothing's hurting on the inside. And so this cute little camera comes with a couple different pictures in them. And so there's like 4 different pictures that we can do and shows different parts of the body. So I really like that because it's engaging and it's playful and it's a way to describe all of what's happening medically in a playful way. And then for a CT scan, we had a wonderful donor actually make this for us. And so it's a super cute CT scan. It looks like our CT scan because ours is white. It doesn't have a whole lot on it because we're inside an adult hospital, so there's not really like pretty stickers or anything like that. But this is a really great way to describe the CT scan in a way that's non-threatening, in a way that a child can understand. It's playful. We can do a little bit of rehearsal beforehand so they can see. I like to use a Barbie doll or something to show them, or an action figure, and we'll talk about how whatever we're taking a picture of, so if it's their legs, we go this way, if it's their head, we go this way. And I'll tell them that their job is to hold really, really still. The camera is inside here and takes pictures, and nothing will touch you and nothing will hurt you. That is usually my mantra for MRIs and CT scans because it can be a very claustrophobic thing. I mean, even in this little toy, you can see that, I mean, Barbie's getting real close with this camera, and so it can be a little threatening. And so just really describing to them that nothing inside here comes out and touches you, nothing hurts you. This is what this looks like. For CT scans where we need to use contrast, all that is for kids that already have an IV. It's liquid that goes through their IV, and I tell them that it helps the inside of their body light up. And so for a younger kid, I might show them a picture like this just because it shows something lighting up. And so we can see if something hurts in their tummy or their throat or if their head hurts. It will light up whatever's hurting so that the doctors can see it really, really clearly. And that's all that that liquid does. The liquid does feel warm, and I do warn kids that it will make them feel like they might be like peeing, but they're not. Weirdly, it creates this warm sensation and to where you're pretty positive you're peeing, but you're not. It's just the sensation that comes along with the contrast. And then for our MRI machine, again, another generous donor. This is our big old MRI machine. And this one's really nice because it can be flipped, and so it shows, actually maybe this wasn't donated, Kane Designs. It's been here ever since I've been here, but I do know that the CT scan was donated. So this one's nice because it can be flipped, because this little nook here is where the child's head will go. And so the child's head will go right here, and then if it's for their legs or for their lower part of their body, it'll be flipped. But it's the same thing. It goes in, and then for the MRI though, you will stay in there for a much longer period of time than a CT scan. A CT scan is not going to be very long of a procedure, usually between like 2 and 5 minutes, if that, to get the picture. For an MRI, it can be upwards of like 30 to 45 minutes to 2 hours, depending on what the child needs. So I like to show them a preparation on, again, the Simply Saying app. I think I have mentioned this in the past. I love this app. I think this app is so important and something that all child life specialists should have. And so it will show the child a picture of the MRI kind of close up. Now, this is not what our MRI machine looks like, so I do recommend if you have the ability to go take a picture of your MRI on your iPad, I would recommend doing that. Then the other thing about the MRI machine is that it makes really, really loud noises. And so for a kid to be able to hold still for 30 to 45 minutes, it takes a lot. And so with the extra sound involved, it can cause anxiety, or it's just an annoying sound. So the Simply Saying app actually provides you with a prompt of the different noises that it can make. And so I'll play the noises, and I'll usually make it a game of like, tell me what this noise sounds like, because the noises can be familiar if you think about it. And so, for instance, and so I've had kids say, that sounds like a construction site outside of my school, or that sounds like a printer, or that sounds like, you know, something that they play with at home, a toy that like makes that kind of construction sound. And so when we make the sounds sound like something a little bit more familiar, it becomes less threatening and something that they're not so worried about. And so there's 4 noises. I'll go through and I'll play all of them, and we can talk about them. And I explain that the noises will be loud, but they will have little cushions that we'll put in their ears, just little earplugs that will go inside of their ears to help make the noise not so loud. For our preschool and under, we'll sedate those patients just because that's a really long time to have a kid hold still. Developmentally, they don't have that ability to not pay attention to something for that long. They want to keep bouncing from thing to thing to thing. You put them somewhere, they want to keep going. And so to be able to like sit down and focus on something that they're not able to move for 30 to 45 minutes is really hard. For our school age and adolescent patients, it's just a matter of having maybe mom be in the room with them, or myself. I've been in the room for MRIs for a lot of patients, and you're basically just being a professional friend for them. And you know, you just hold their hand while they're in there, or like have your hand on their leg, just that comforting sense of like, I know I'm in this tube and it's scary, but there's somebody here with me. Makes it a little bit less threatening and helps them relax. So I hope that was helpful, and I hope you have a great rest of your day.